causes of cancers are multifactorial. There is no certain cause we can pinpoint that can contribute to development of certain cancer, although there are strong links between certain cancers and exposure to certain factors. However, some patients will develop cancer and others won't. So some researchers contribute the cancer development to failure of immune system, because the immune system has a capacity to repair damage incurred by DNA or remove the cancerous cells. However, we still don't know why some people respond to factors that cause cancer and others don't. Progression of the cancer after the initiation of the exposure can be rather rapid, and depending on diagnostic techniques, of course early diagnostic is always favorable, but depending on diagnostic technique, the treatment may be delayed. And one of the main points here that diagnostic should be performed early, and suspicion for cancers should be treated with all seriousness, and those patients should be evaluated and assessed as thoroughly as possible. Also, of course, we have our screening methods. So if recovery occurs after the treatment from cancer, we do not use the word cure, of course, and we're using word remission. Unfortunately, some cancer will result in terminal outcome, and at that point we need to think about facilitating the end of life measures and initiating hospice care. There are many causes of cancer. Chemical carcinogens are present everywhere, and some of them have industrial origin, such as asbestos is very well known, linked to lung cancer, and nickel was causing cancer for industrial workers. Hormones are linked to development of certain cancers, such as prostate and breast cancer, and estrogen production in female can lead, excessive estrogen production, of course, can lead to the cancer of breast and uterus. Prostate cancers are testosterone dependent, and one of the treatment or one of the palliative treatments to slow it down or even inhibit is estrogen treatment and halting the testosterone production. But again, these are the two of the best examples, estrogen and testosterone, and then their correlation to the cancers. Radiation is another cause for cancer, and when we're talking about radiation, we know about ultraviolet exposure. The ultraviolet exposure can result in skin cancers. We need to remember here that skin cancers can develop differently. In case of basal and squamous cell carcinomas, it's the cumulative damage occurred over the years, while malignant melanoma, the most dangerous type, is occurring secondary to blistering sunburns incurred in childhood. So the bottom line, encourage your patients to use the protection, especially in pediatric populations where the prevention can truly result in elimination of the cancer further in the life. Viruses can be another cause for cancer, and the best example is human papillomavirus and correlation to it of it to cervical cancer. And genetic predisposition may play significant role in developing the cancer. Again, as it was said before, some people may develop cancer being exposed to exactly same factors, while others will not have cancer development. Cancer prevention is important topic in healthcare nowadays, and one of the easiest ways to prevent it is to avoid carcinogens. Carcinogens can be detected as industrial carcinogens as well as environmental, such as smoking. Although there is no strong link with alcohol, but with some cancers, alcohol certainly can play a role. As it was said, skin protection may play a role in cancer development. Also, avoiding air polluted regions may prevent development of the cancer further in the life. Another important topic is the hormone therapy and its effect on development of cancer. It's important if you are, let's say, using contraception or hormone replacement therapy for your patient, is to adjust the therapy to minimal effective one, because increase in hormone therapy may certainly reflect in incidence of cancer. Calorie intake and exercise, these two go together, and I won't be boring you with the details, but body fat can contribute to chronic inflammation, and chronic inflammation may result in cancers of many different types. Screening is important. There are proven screening techniques and there are questionable ones, and there is major revision of screening techniques. Still, mammograms, self-breast examinations are one of those valued techniques, while nowadays the screening for prostate cancer with digital rectal exam becoming more of an archaic, non-effective way of screening. And we'll talk about this while we're talking about those disorders in further meetings. Colonoscopy is another effective way to screen for colon cancers, and the results certainly visible nowadays, which reflects reduction in colon cancer rates overall in population. Monthly examinations important in cancer prevention, and this involves breast exam and testicular exams. At the same time, regular checkups like pap smears for females and prostate exams for males. Again, it's becoming questionable practice nowadays, and it's not encouraged anymore. Rectal examination for males and female may be of lesser value nowadays, considering the limitations of those exams. However, colonoscopy for screening purposes is certainly one of the greatest. However, colonoscopy for screening purposes is one of the greatest tools. So, frequency of cancer is an important consideration. It's still second leading cause of death. Gender effect is important to consider because some males are affected by certain cancers while females are affected by other cancers. Again, prostate and breast cancer. Lung cancer used to be male-dominated disease. However, the shift nowadays is towards female population developing more cancer. It's the reflection of overall reduction of smoking rates among male population. Age contributing factor to cancers. And for instance, there is a statement about prostate cancer that every man may develop prostate cancer depending how long they live. So with age, you certainly may develop cancers. However, some people don't live that long. Most common cancers, again, as we talked in the beginning, breast cancer for women and prostate cancer for men, and also colon cancer. Frequency of cancer is different for male and female patients, and on this slide I want to show you frequency for general population, and by frequency we mean the occurrence of cancer. So this shows the most common cancers, excluding skin cancers, which are the most common ones, and the most common type of cancers is basal and squamous cell carcinomas, which are very treatable because they are visible on the surface and they are slow growing, and the excision or surgical treatment removal is very, very beneficial and has good good remission rate. So this type of procedures can be done, of course, in physician's office, dermatologists, or depends on the practice, and usually again have good success rate. Malignant melanoma is, as I was saying, it's a deadly skin form cancer, and approximately 1% of all skin malignancies will be malignant melanoma. So for the simplicity wise, I included here only non-skin cancer. So most common cancer is lung cancer, followed by colon cancer, breast, uterus, and prostate. Again, when you see at this list, you may think that prevention may be actually very beneficial, because most of the cancers in this colon may be either prevented by avoiding certain lifestyle choices, or be discovered relatively early in their development, secondary to screening techniques. But again, lung cancer rates may dramatically decrease if the smoking dangers will be eliminated. But again, this is most contemporary list. You may find something different from different sources, but again, lung cancer dominates this list, and most of the time you see it's topping the list of cancers. When you look at female and male distribution of cases of cancer, prostate cancer dominates for male patients, approximately 25% of cases discovered in a year, and breast cancer for female patient, approximately again 25-26% of cases discovered in a year. But for both male and female lists, the lung cancer will be second and colon will be third. So because breast and prostate cancers are so gender specific, they don't make to the top of the list, and when we're looking at general population, again, lung cancer is the most common one.